Let everyone in. Welcome, welcome, welcome everybody to Care Concierge with Care Patrol, where education is the heart of everything we do. Care Patrol, for those of you who are new to us, is a referral and placement agency. We work with assisted living and sitter services to find clients and to share with clients those options that we found at no charge. We assist clients with asking questions and vetting providers of care and help them through the process of placing a loved one into community care or with a sitter in the home. And as part of what we do, we educate our clients, and that extends to you. We educate social workers and nurses. We are accredited by the Alabama Board of Social Work and of Nursing to provide 1.0 contact hour for today's presentation. This presentation, in order for you to receive credit, you must do the evaluation. The evaluation is password protected. And that evaluation must be completed by the end of today. You will receive a certificate in the mail stating that you have completed it and have received a certificate, and nurses will be posting your hours online. For those of you who are not looking at your screen, I'll now read to you the evaluation link so that you can take the evaluation and receive credit. And this would be true if you saw this presentation later on YouTube. You could receive pre-recorded credit, but because we use a password today, then this will be considered a live hour by the Alabama Board of Social Work. The evaluation link, for those of you who are not able to see the chat room, and we do encourage you to use the chat room. And if you're unfamiliar with Zoom, move your cursor to the top of your screen and a black bar should appear down that has the word chat on it. Click there. If that's not the case, move your cursor to the bottom of your screen. You'll see the bar pop up with chat on it. Click there and join the discussion. I know that our presenter, Holly Mask, who's a licensed clinical social worker, will appreciate you asking questions about her topic today, which is near to her heart, animal-assisted therapy. Our evaluation link, for those of you who are just joining us, I'll read to you our evaluation link. It is https://www.surveymonkey.com/lowercase r/all uppercase letters, D as in David, 3 3 H 2 2 Z as in zoo. That's our evaluation link. One more time for those of you just joining. Our evaluation link is https://www.surveymonkey.com/lowercase r/uppercase letters, D as in David, 3 3 H 2 2 Z as in zoo. And I've posted this in the chat room. Please do check the chat room for it and add your comments and questions to Miss Mask, who is our presenter. We're happy to have her today. She's been working with Mary Harper Center for the last 5 years, but animal-assisted therapy is near and dear to her heart. And Mr. Chewy, I hope I've said your name correct. The password we give out at the end of today, and that is how we convince the Alabama Board of Social Work that you've been here, that you've listened to a live presentation, and that you deserve a face-to-face or classroom hour. So the password we give out at the end today But without any further ado, we will turn the program over to Miss Holly Mask, Mrs. Holly Mask, and we appreciate her time today. Thank you so much.
No, thank you for having me. Thank you for signing up for this presentation today. I always enjoy talking about animals. It's a good thing to do on a Monday at lunchtime, I think, just to kind of get us through the rest of the day. So like Sean said, my name is Holly. I'm a social worker. I currently work at the Mary Stark Harper Center in Tuscaloosa. And when I'm not working, I volunteer with an organization called Hand and Paw Animal Assisted Therapy. It's a nonprofit organization that is based in Birmingham, although we do have a group of people here in Tuscaloosa. And we provide therapeutic visits using animals in a variety of settings, including hospitals, nursing homes, schools, assisted living facilities. And we recently started doing a court program in the Jefferson County Family Court. I've been with Hand and Paw since 2013, I believe. I started off as just a excuse me, a therapy pet handler. I had a therapy dog. And then when I started to get more involved with the organization, I started to lead groups using animals as like a positive reinforcement, working with adolescents, teens and adolescents out at Hillcrest. Did some stuff with the WOW program here in Tuscaloosa. And for the last few years, I've been volunteering as an evaluator for Hand and Paw. So I meet with potential new teams. There is an evaluation that is required. I'll go through that information later in the presentation. But I do conduct those evaluations for people that are wanting to visit with their therapy pet. So that's a little bit about me. Why is my presentation not working? There we go. So just some objectives for today. Just being able to identify and discuss the three main types of working animals that we're probably all most familiar with. You have service animals, emotional support animals, and then of course therapy animals. We'll discuss the difference between animal assisted interventions and animal assisted activities, and kind of discuss how animals can be used in different environments for different populations. And then we'll kind of go over some of the physical and emotional benefits of animal assisted therapy for various folks. Okay. So the first thing that I always like to do with this presentation before I get too much into it is to go over the difference between a service dog, an emotional support animal, and a certified therapy animal. Because you're not super familiar with this line of work, most people, it's common to think that any animal they see out in public is probably a service dog or an emotional support dog, but they're all quite different. So a service dog, and if you've attended this presentation before, there have been some changes. I made some changes to this slide. I think since I gave this presentation last, there have been some changes to laws and certain policies surrounding service dogs and emotional support animals, because I think people have sort of taken advantage of being able to have an emotional support animal, and so they've had to become more strict with regulations and stuff like that. So a service dog under the Americans with Disabilities Act, it is strictly reserved for dogs. You cannot have a service cat, you cannot have a service miniature horse. It's got to be a dog. And these dogs are individually trained to perform very specific tasks for their handler. they serve one person, which is their owner, and they're working dogs and they have very specific jobs. They are covered under the ADA. They are protected legally under the Americans with Disabilities Act. And because of that, because they are considered a tool to help that person with a disability to live an everyday life, and they're covered legally, they are allowed to accompany their handlers in public areas, restaurants, grocery stores, public events, airports, theme parks. I know I've seen over the years, it feels like the presence of service dogs has increased when I've gone to like Disney World and theme parks and things like that. But a service dog also requires some significant training, or lots of significant training, in order to perform that specific task for their owner. So as I said, it's defined as a dog that has been individually trained to work or perform for an individual with a disability. An example of a disability that a service dog might address is someone who has a visual impairment might have a guide dog. Someone who is hard of hearing might have a hearing dog. Their seizure response dogs are becoming more common. I've seen a lot of articles now about diabetic scent dogs, and I think they're training dogs to kind of sense like certain symptoms of cancer and things like that. Of course, another big area that service dogs are used for are for things like PTSD and other forms of mental illness. And I wanted to specify that a psychiatric service dog is different from an emotional support dog in the sense that a psychiatric service dog is trained to detect oncoming psychiatric episodes and to provide a specific intervention for that. So an example might be if somebody has a panic disorder or is prone to panic attacks, a psychiatric service trained dog may intervene when they sense the oncoming of a panic attack by providing deep pressure therapy, by maybe placing their front legs on that person's chest or laying on top of them and providing that kind of like a weighted blanket kind of effect, just to kind of regulate their breathing and their heart rate and to help them relax so that they decrease the chances of that panic attack happening. Another example might be, let's say somebody has like PTSD, and one of the symptoms of that diagnosis might be night terrors, nightmares. A trained psychiatric service dog would be trained to wake that person in the middle of a night terror, and then maybe also provide that deep pressure therapy after the person has woken up from their night terror to provide some support and comfort. So going back to what I said about they've made some law changes as far as, service dogs and emotional support dogs. I think, typically in the past, people were not required to show any kind of documentation for a service dog. They were automatically, covered legally and, welcome in any kind of place. But I think with the introduction of emotional support animals and people kind of the prevalence of taking your pet into a public place, it's just become more prevalent. There have been some changes to where just because you have a service dog doesn't mean you're automatically like you can still be asked for documentation in public, which that wasn't always the case. And even though that animal is, if you have documentation to support the fact that this is a service dog providing a specific task for a person with a disability, you could be if the dog poses a risk to the safety of other people or poses a health risk, or for some reason the handler is not complying with the rules of the establishment, they could be asked to remove the animal. That that's, like I said, it's a little bit different over the past few years with the people, occurrence of people bringing their animals into public places. So that's a service dog. Now we'll move on to emotional support dogs and certified therapy dogs. Now, when we talk about emotional support and therapy, these are not limited to just dogs. I'm sure you've seen the stuff on the news where, people try to bring like an emotional support peacock on a plane, or, we don't have any therapy peacocks, although, I mean, I guess you could have that. But many people, in addition to dogs, might have a cat, might have a rabbit or a guinea pig. As far as therapy goes, I'm sure you guys have seen miniature horses, miniature donkeys, llamas, alpacas, pigs. So you could use a variety of animals, species. It doesn't have to necessarily be dogs. So the purpose of an emotional support animal, it's not a service animal. So they're not, protected under the Americans with Disabilities Act. They're not trained. They don't go through rigorous training to perform a specific task to address a specific disability. But they're not a pet, necessarily. They're a little bit more than that. They do provide, some relief to that individual in the presence of whatever symptoms they might have. But they don't perform a specific task to relieve those symptoms other than just being present. In order for an animal to be designated as an emotional support animal, it typically requires a prescription letter from a licensed mental health professional or a physician stating what the handler's needs are and why the emotional support animal is necessary. This is another change to this slide if you've attended this presentation before. Previously, emotional support animals were protected both under the Fair Housing Authority Act and the Air Carriers Act, meaning that regardless of where you lived, like let's say you live in an apartment, you rent, the landlord doesn't normally allow any kind of pets. If you have an emotional support animal and a letter from your doctor saying you must have the animal, then that landlord is required to allow you to keep that animal in your residence. With the Air Carriers Act, basically it was, stating that if you had an emotional support dog and or an animal, and you had a letter from your doctor that you would be able to carry the animal onto an airplane. But I think because we've gotten a little lax with, emotional support animals and what kind of animals we were considering as emotional support animals, and also animals not being properly behaved or properly maintained or cared for. They've had to really tighten up on restrictions. It kind of seems like it's per airline. One airline might be a little bit more lax than another. But as far as the whole law goes, the Air Carriers Act, they're not technically covered anymore. The Air Carriers Act now only covers service dogs. They will not cover an emotional support dog. And I think they would kind of consider an emotional support dog a pet. But like I said, if you have an emotional support animal and you're, preparing to take a flight, just check with that airline to see what their policy is. So then sort of on the other far end of the spectrum, we have therapy animals. So, unlike service dogs and emotional support dogs, like, they're not protected under the Americans with Disabilities Act. They're not trained to do a specific task like providing deep pressure therapy to somebody who has panic disorder. They're not necessarily providing to the emotional needs of their handlers. Their main job is to support others and to promote the wellness, well-being of other people. They do serve a specific purpose like service dogs or emotional support animals. But that purpose is different. As I said, it's to promote the well-being of other people, and any visits that they do have to be done with prior approval. And the goal is usually to promote socialization and well-being. They are not protected under the Americans with Disabilities Act, the Fair Housing Authority Act, or the Air Carriers Act. They may be allowed in some public places, when they're not working. But usually it's going to be places that allow like typical pets. They don't qualify to fly on airplanes or to go into theme parks or anything like that. A kind of good example of this, maybe, I don't know if you guys have seen it, but with the Olympics going on, the USA gymnastics team has their own therapy dog. I can't remember his name. Is a golden retriever. But he's during when they're nationwide, like when they're in the country, he's allowed to travel with the team, but he wasn't able to go with the team over to Paris because he's not technically a service dog or even an emotional support dog. He's a therapy dog. So he's, cheering them on from his living room in Pasadena, California. But so that's just that kind of goes over the difference between a service dog, emotional support dog, and a therapy dog. Does anybody have any questions about that or comments or anything else they want to add? Nothing? Okay. So just a little bit about the history of, use of animals and therapeutic interventions. Every time I start doing research on this subject, it seems like they've added more and more literature, and they've found more and more history dating way back. So like in this slide, the new piece of information I found was, back all the way back to the 9th century in Belgium, they were using animals to treat people with disabilities. But the earliest, most talked about incident of animal-assisted therapy occurred in York, England in 1796 at a psychiatric hospital called the Retreat. It was run by Quakers, and they kind of took a religious approach to psychiatric treatment, but they wanted to incorporate a more psychosocial approach. And so they encouraged their patients to participate in, farm laboring and to care for the animals. And they started to see that this was really therapeutic for the patients. One study that I read, or one article I read, talked about how the patients would tend to the rabbits and the chickens, and for some reason it helped them to learn self-control, which I could kind of see with chickens. I don't know that I could see that with rabbits, but and then in the late 1800s, Florence Nightingale, for anybody that works in nursing, has a nursing background, she found that children and adults that she worked with that were in mental health settings tend to have less agitation and anxiety when working with animals during their therapy. And then the next time that we see kind of a heavy use of animal-assisted therapy in history is in the 1930s with Freud. And this was sort of kind of happened upon, he happened upon this. He had a dog named Joffy. That's Freud here in this top picture with Joffy. If you are a dog person, you'll notice that this dog is a chow, which I think is an odd breed to use in individual psychiatric therapeutic interventions, but it worked for Freud. So that's kind of a good representation of the breed. But he would use his dog Joffy during therapy sessions, sort of he noticed that his patients kind of used Joffy's presence as like a stepping stone into therapy. and it started to promote, or it started to make them feel more comfortable to communicate during their sessions. And Freud also used Joffe as a way to kind of determine the level of tension that the client was experiencing. For instance, if Joffe didn't move towards the client or didn't seemed hesitant to interact with the client or have the client pet him, then Freud was able to determine that the client was having some tension that needed to be addressed in the session. Or if Joffe was very interactive with the patient, Freud determined that his therapeutic interventions were probably, working pretty successful. So the Freud's work, he recorded his work in journals and articles, but these weren't really discovered until 20 years later. And then after those were found in the 1960s, Dr. Levinson was the next kind of big event as far as history and animal assisted therapy goes. He was working with a client. It was a 9-year-old boy who was nonverbal and had been diagnosed with a serious mental illness. And his dog Jingles was in the room, and he happened to step out of the room, left Jingles in there, didn't think anything of it. When he came back, this nonverbal child was sitting on the floor, interacting with Jingles and talking to Jingles. And Dr. Levinson was kind of stunned and was like, well, maybe there's something to this. So, he started to implement animal assisted therapy. He wrote lots of papers, did lots of research. He kind of became known as the father of animal assisted therapy. He and a couple other people. And in 1972, he in his research found that about a third of the therapists in New York alone were using pets in treatment. So everybody was starting to kind of figure out how beneficial it was. So the next big person that was a big contributor to the field of animal assisted therapy was Dr. Lorenz. He and Dr. Levinson are kind of considered really the two of the three pioneers in the use and research of this area. And they were important in establishing this idea of the human-animal bond, which kind of is the foundation of animal assisted therapy, and basically discusses that humans have this sort of natural need to bond with nature and to have relationships with animals or things in nature, which kind of gives a foundation as to why animal assisted therapy might be really effective. So the third out of the three people that were are considered, the most important in the establishing of this area, this field, is Dr. Bustad. He's the founder of Delta Society, which is now known as Pet Partners. He was a veterinarian who took the idea of Lorenz and Levinson of the human animal bond, and he kind of promoted it and made it more well known. And based on his knowledge of this and sort of promoting it, he was able to establish the Delta Society, which kind of sets the precedence for animal assisted therapy as a field, and subsequent organizations providing this service. It's the most prominent in the country. If you go on their website, they have tons of information, research. They provide specific certifications of their own. They advise smaller agencies, organizations throughout the country on providing this level of care. So it's, they have a lot of good information on their website. Okay. So Some examples of animal assisted therapy. It kind of branches off into two areas. You have animal assisted interventions and then animal assisted activities. So animal assisted interventions are specific tasks that are led by a health or human service professional, a psychologist, social worker, occupational speech therapist. And there's a specific goal or a specific task that has to be accomplished. It's part of a treatment plan. The animal assisted interventions and animal assisted activities, are similar in the sense that they're put in place to improve different aspects of a person's physical health, social well-being, emotional health, cognitive functioning. But the animal assisted interventions are specific, they're individualized based on a person's specific needs and care plan. So some types of animal assisted interventions. You have animal assisted therapy, which, it could be a psychologist, providing that service and individual therapy. The animal could belong to the psychologist, or a therapy pet handler could be in the room while the psychologist is providing an intervention. Animal assisted activities, typically done in sort of a group setting. They can be delivered in a variety of environments. And they don't necessarily have to be provided by a health or human service professional, or facilitated by one of those people. For example, me as a hand and paw volunteer, I could facilitate an animal assisted activity because I'm trained and certified to do that by an organization. Animal assisted education. If you guys are familiar with any kind of animal assisted stuff, sometimes you'll see pictures or videos of animals, dogs going into schools and sitting there while kids read to them, or dogs visiting children in a classroom. That would be kind of an example of animal assisted education. It's obviously done in an educational setting, and it's a structured intervention that's used to address educational goals. In Hand and Paw, we have a program that I'll cover later on called Sit, Stay, Read. And therapy team will go into a school and they'll be paired with a student, and there's a teacher in the classroom. The teacher's, leading the class, and the therapy pet handler is just kind of there to observe and let their dog do most of the work. But the children are practicing their reading and comprehension skills. They practice by reading aloud to the dogs. And it's supposed to be therapeutic in the sense that, reading to an animal is much less intimidating than reading to your peers or an adult. The animal just kind of sits there and listens and doesn't judge and doesn't react negatively. Just is very calm, and it just makes people feel more comfortable when they're trying to work on something like reading skills. Then you have resident animals. I know at one point the VA here in Tuscaloosa had a couple of resident dogs. They were, they're cared for by employees or members of that organization, but they're owned by that organization. So, whereas with, let's say, animal assisted therapy, most of the animals that are used are, when they're not on a visit, they're somebody's pet. At least in Hand and Paw, they're somebody's pet and they live at home with somebody. They're not owned by Hand and Paw. But a resident animal, for example, the dogs out of the VA are owned and cared for by the VA. They just happen to go home with a VA employee every night. Are there any questions or concerns, comments, feedback?
No questions so far, but we do encourage folks to add their questions or comments to the chat room at any time.
So some of the benefits of using animal-assisted interventions in practice, some of the physical benefits, lowering blood pressure, lowering heart rate, improving oxygen stats and nervous system response. At least in hand and paw, we do a lot of work with like occupational therapists to help both children and adults improve sort of their gross and fine motor skills. Gross motor skills being like walking and talking, um, and then fine motor skills like in hand and paw we have these vests that the dogs can wear, and there will be like buttons and zippers and pockets, and the patient has to um, you know, uh, practice buttoning, unbuttoning, or zipping or unzipping. And somehow just the presence of the animal being there, it's comforting, and people are more encouraged and more excited to practice these skills that otherwise might be kind of difficult for them. Encourages physical activity. It's been shown, animal assisted therapy has been shown to reduce the risk of asthma in adults. It also has positive effect on cognitive functioning. As far as emotional benefits, reducing levels of anxiety, depression, agitation, promoting positive socialization, lowering cortisol levels, which is a stress hormone, and encouraging the release of good hormones like serotonin and dopamine. In children, it has shown to improve, their level of concentration in group activities or in a classroom setting. And it's also encouraged, a certain level of engagement from them, like the Sit, Stay, Read program. If a child is having a hard time learning to read, they may isolate, they may not want to participate, but because the dog or the whatever animal is there, it's not judgmental. It just, the child might be more willing to engage. It
We have some comments and questions.
Okay.
One, Miss Ingram says, no questions. Learning new things, awesome teaching. Miss Albright says Spain Rehab now has a facility dog. Uh,
Okay.
Miss Ajamale asked, how long does it take to train the dogs?
For a therapy dog.
Yes.
Um, so every organization probably has a different approach to their training. But as far as hand and paw goes, the only thing that is required as far as training goes is that the dog have a basic group obedience class. Um, of course, if you're wanting to do therapy work with a different kind of animal, like I have a therapy cat, I'm obviously not going to take her to an obedience class, but I do practice kind of socialization things so that when she goes into an evaluation, she's accustomed to being handled by different people and stuff like that. But if you are wanting to go through the process with a dog, typically all we require is a group obedience class, which, are usually a few weeks, 4 to 6 weeks, once a week. You can go to PetSmart, or if you're in the Birmingham area, there are a ton of places that offer obedience training. But, basically we want therapy dogs to have basic obedience. We want them to know how to sit, how to lay down, how to come when called, very basic, walk nicely on a leash, very basic obedience. The main thing that we're really focused on is how the dogs interact with others, and how they react in stressful situations. So that's that question.
Miss Simon is asking, with having an emotional support dog, does the documentation required to provide the housing property manager have to go in detail with listing the disorders for the person? And then she follows up with this question. Also, can an emotional support dog be trained to become a service dog, and or service dog limited to specific breeds?
So service dogs, I don't believe are limited to specific breeds. Now, I mean, most of us are familiar with seeing the golden retrievers and the labs, as service dogs, but I've also seen shepherds. I've also seen pit bulls. It just, I don't think it's breed specific. There are some breeds that are better for it. But if you have a certain kind of breed that's not the most common that ends up being a good service dog, that's great. Um, uh, Training an emotional support dog to be a service dog, I'm sure it could be done. But typically, service dogs, are bred, dogs are bred to be service dogs, and they start their training like from very young age, 12 weeks. So I think if you had an adult dog that was an emotional support dog that you wanted to train to become a service dog, it might be more difficult. As with most of us as adults, we're kind of set in our ways. But I don't think it would be impossible. Um, as far as the documentation, for an emotional support animal in the Fair Housing Act, it just has to be like a prescription letter from your provider that says this person needs this animal due to this diagnosis. But I don't know to what level of detail they have to go into.
Okay. And Daphne Williams is asking if a person needs a service dog, who pays, the person or health insurance? If the person, how much do they typically cost?
Yeah, I don't think health insurance will pay for a service animal. I think it's generally the individual will pay for a service animal. There are organizations, I believe, that will provide some level of financial assistance, depending on the need. But I think for the most part, on the it's the responsibility of the person in need of a service animal. And typically they're like thousands of dollars. Like in reviewing some updated information for this presentation, I was reading something on seizure detection dogs, and they can go up to like 20, $30,000. So, in that case, people would have to work, most of us would have to work with an organization to get some sort of scholarship or financial assistance. Because unfortunately, like I said, I don't believe health insurance covers it.
I know with Service Dogs of Alabama, which is in Montgomery, they state that it costs about $40,000 to train a dog, but they mostly provide them at no charge through grants and fundraising.
Yeah. And I think, as people become more aware of how beneficial this form of assistance or treatment is, there will be hopefully more funding, more resources, more support so that people can have, they can have it as a tool to improve their daily living. Any other questions?
That's it for now. Thank you.
Okay. Um, so like I said, physical and emotional benefits of animal assisted therapy. In doing the research for this presentation, most of the stuff that I read was, emotional or mental health related, like the anxiety, the agitation, serious mental illness, PTSD. Um, but I think, as the years have gone on, the research has started to show all of the physical benefits that this has as well. Um, and so some of the, you know, at least at this point in time, some of the most common diagnoses that you'll see in the research articles are your Alzheimer's, your autism spectrum disorder, anxiety, SMI. But we also see benefits in cancer, people with cancer, people with cardiovascular issues and seizure disorders, cerebral palsy, muscular dystrophy, and then other kinds of terminal illnesses. So qualities of a potential therapy dog. Um, so I'm trying to think. A lot of our what we're focused on is the dog. There's also a lot of training that goes into preparing a handler. But we want to make sure that when evaluating a potential therapy dog that we take safety and liability into account, and also the level of contentment and happiness of the dog. We want to make sure that it's a dog that's going to be happy in this line of work. We look for dogs that are well socialized, that don't mind interacting with strangers of all genders, ages, races, ethnicities, is, comfortable in stressful situations, maybe, somewhere that's crowded or noisy. A dog that, doesn't mind if strangers kind of approach and suddenly start petting it or squealing, just kind of sits there and is like, okay, this is fine. And not only are we looking to see that a dog is willing to tolerate that, but we also are looking to see that the dog is actively seeking that engagement with these people, with other people. We're also looking to see that the dog has good obedience skills, so very basic obedience. Being able to walk nicely next to you on a leash, following basic commands, not jumping on other people, not mouthing other people or biting on their leashes. And excessive licking is something that we kind of monitor too, from a health concern standpoint. We want to make sure that, the dogs are not aggressive towards other people or other animals. We, want them to be comfortable with medical equipment. If they're going to go into places like nursing homes or hospitals or rehab facilities, they're going to encounter a lot of that. And so we would just want to make sure they're comfortable with being around it. And also, not becoming too stressed about unpredictable environments or uncontrollable environments. So the training process for a therapy dog, this is specific to hand and paw. So different agencies might have different requirements, but for our teams, we ask that the dogs be at least 18 months old, that they be owned by the potential handler for at least 6 months. Of course, they have to complete a basic obedience class before they go through the training process. They have to be up to date on all vaccinations and flea and tick and heartworm prevention, and they have to be spayed or neutered. So the steps in the process are, once you complete your basic obedience class, you submit an application to Hand and Paw, providing, some information about you and your pet and why you think you guys would be a good team and why you're interested in Hand and Paw. We'll do kind of an initial interview and a screening to kind of assess, the dog's suitability to the job. We might kind of screen for some basic obedience. We might do some sort of role plays with volunteers in the room just to see how the dog interacts with strange people. If we feel that the dog is a good fit, then they're accepted into Hand and Paw, and they are signed up for the training process. So there are several workshop sessions that basically during these sessions, what we do is we break down the actual evaluation that we use. We break it down into, I think, like 4 sessions, and we go through each movement of the evaluation. And the evaluation has a couple different areas. You have obedience, and then you have kind of simulation where you practice walking down a crowded hallway, or practice walking where there might be, loud noises or a lot of medical equipment. And then there's a part of the evaluation where we do role plays, where you interact with somebody in a wheelchair, you interact with somebody using a walker, you interact with a crowd of people. So the workshop is focused on, breaking down all the portions of that evaluation and preparing the potential team for success when they finally get to that evaluation. And then we evaluate. If, you pass, then you become a new team. There's an orientation. We do a shadow visit, just to see, just to make sure you guys are going to be appropriate, address any concerns you might have on your first visit. So the training process for handlers, there's a lot more training that goes into it for handlers than dogs, really, because I mean, if your dog actively seeks out engagement from others and, is excited to visit and is laid back and is not concerned about, equipment and has basic obedience, basically your dog has done the job. So we need to train the people. So we go through, there's an extensive application process, the initial interview with hand and paw staff. We do a background check. Once you complete the screening with your dog, we ask that the handler do a shadow visit. That's where you go on a visit with a current hand and paw team, and you just kind of shadow them to see what a visit is like. Of course, the training workshops that I talked about, where they're, you break down the evaluation into sections, then you participate in your evaluation. If you pass, we do a supervised visit where you sign up for a predictable visit. So we have a bunch of different places that we go to, and we separate those visits based on whether they're predictable or a more specialized population. So a predictable visit might be somewhere like an assisted living facility or a nursing home, where it's going to be a more laid back visit. It's going to be in a large open area, and it's going to be very general interaction. Versus a more specialized visit might be if you're visiting like the pediatric wing at a hospital, or a cancer center, or participating in a court system kind of visit. So we do the supervised visit at a predictable location like a nursing home or an assisted living facility. There's a certain number of visits you have to complete, predictable visits. I want to say it's like 8. You have to complete 8 visits in predictable settings before you are considered qualified to receive the training for more complex environments. And once you receive that training, then you, of course, can go to places like correctional facilities and courts, hospitals, things like that, schools. In addition to all of that training, some places that you sign up to visit have their own training that they want you to go through. I know when I've done like DCH or anything through the University of Alabama, we have to go through basically what is their employee orientation. So we have to cover things like, infection control, HIPAA, stuff like that. As a hand and paw therapy team, we are required to reevaluate every 2 years, and that's for, from a safety kind of liability purpose. Just like us, animals' personalities change, their behaviors might change. They get older, they might not be as, willing to engage with a whole lot of other people as they were when they were younger. So it's important that we reevaluate these teams every 2 years to ensure that they continue to be appropriate to go out into the field and visit with people. So in total, the training process takes about 20 plus hours. It's done over a pretty extensive period of time, I'd say 6 months to a year. But it is very rewarding. It's time consuming, but it does not necessarily really cost anything, other than like the obedience class that you have to take before you submit an application to Hand and Paw. But the workshops and stuff that you do through Hand and Paw, you do not have to pay for. Everything is kind of a volunteer thing. It's a nonprofit agency. And these are just some pictures of some, other kinds of therapy animals. I probably use the word dogs a lot, and I try to correct myself and say animals because more than dogs can do it. So, in Hand and Paw, we've had goats, we've had guinea pigs. We've probably had rabbits. I think currently we just have a couple of cats, but mostly dogs. But people also use pigs and miniature donkeys and miniature horses. Basically this shows that you can use any species of animal. It's based on the individual animal. So just a little bit more about Hand and Paw. It's a nonprofit. We're based in Birmingham, but like I said, there's a group of us here in Tuscaloosa that visit facilities in West Alabama. It's comprised of 7 staff members and a board of directors, and all of the services that are provided by Hand and Paw are free of charge. As of 2023, we had 92 registered therapy teams in both Birmingham and Tuscaloosa. 18 therapy visit assistants. These are individuals that don't have a therapy pet, but still want to volunteer and be a part of the organization, and they go and they assist therapy teams on visits, and they are extremely vital to the success of a visit, especially after the COVID pandemic, where we're constantly having to ensure that people are sanitizing their hands and not getting too close. They're extremely valuable. And we currently visited over 91 places. So we do a lot of visits. In 2023, we provided over 99,000 therapeutic interactions over the course of over 4,000 visits, which added up to 5,700 hours.
We have a
So,
question, which
oh
is
yeah,
Ms. Williams is asking, who actually needs to do the letters for certifications for ADA service dogs, emotional and therapy dogs?
I would think a physician.
Okay. And next question, does it take longer to train specific animals for therapy services like the goats, pigs, cat, and miniature horses and donkeys?
I would think so, because dogs are just so naturally suited to therapy work. And even though they have to do an obedience class, um, it, it's so common that, it's, I think it would be easier to train a dog. Now I know with my cat, I can't the evaluation that's done for a cat is different for a dog, in the sense that, she's not practicing walking on a loose leash. She's not doing sit, or down like a dog might. Um, she's having to do more, kind of like role plays and socialization stuff. Like in the cat evaluation, there's a part of the evaluation where she has to be passed between 3 strangers, and each person has to hold her for at least 30 seconds. So I would think, training an animal like a cat or a horse or a pig would probably take more time, because you have to get them exposed to different environments, and it's doesn't come as easily to them, I don't think, as it would a dog.
Next question, some places or facilities do not allow aggressive breeds of dogs. You mentioned the pit bull. So if a pit bull is trained and certified as a service or therapy dog, does the training eliminate their natural instincts to get aggressive? Have there been any documented incidents with the more aggressive dogs?
Not in my experience. In Tuscaloosa, we've had a couple of therapy dogs that were pit bulls. We've had a Doberman Pinscher, and I think we have currently 1 German Shepherd. And they're all wonderful dogs. We've never had any incidents of aggressive behavior during any visit with any of these dogs. I don't know about any specific occurrences of aggression from a service dog because of its breed. But I would imagine that establishments couldn't really exclude a service dog based on the fact that it was a certain breed. If it's, if an individual is ordered by a physician to have that service animal, and that service animal has been, certified and trained to provide that specific job, whether or not it's a pit bull or a golden retriever really shouldn't. Of course, I know it does have an impact, but it shouldn't.
We're up against the hour, so I'll give the password. It's a capital T therapy, THERAPY, capital T therapy is the password. The link is https://www.surveymonkey.com/lowercase r/ all uppercase letters, D as in dog, 33H22Z as in zoo. And continue on, Holly.
Okay. I think my other slides are just sort of more information about hand and paw, which, if you're interested, if you are a member of an agency that you think could benefit from hand and paw services, you're welcome to go to the website and do more research. It's handinpaw.org. But this is just some examples of the specific programs that Hand and Paw provides. Hip Cares, Hip Heals, and Hip Reads. So Hip Reads is that sit, stay, read program that I had mentioned earlier, where therapy teams are going into schools, into reading comprehension classrooms, and they're assigned to specific students, and the students practice reading, to that team for a certain period of time. And then the teacher kind of assesses their progress and, makes a determination at the end of the course. Hip Heals is the specific animal assisted interventions that we talked about. Some examples of this would be like a physical therapist incorporating, brushing a dog's fur or walking alongside of a dog to improve gross and fine motor skills. And then Hip Cares is sort of like our animal assisted activities. So like Paws in the Court, that's Hand and Paw is currently going into the Jefferson County Family Court system. And basically the job of that therapy team is to provide emotional support to, usually children during court proceedings. And then School's Best Friend is basically just where we're going into an educational setting, a school environment, interacting with kids and providing opportunity for, positive socialization, social interaction, things like that. And then this is just an example of some of the places that we visit. I tried to include some of the big places that people might have heard of. I know that, people that participate in these presentations are kind of from all over the place. And Hand and Paw is not the only agency in Alabama that provides these services. Most big metro areas throughout the state have their own agency. I know Huntsville has one, Montgomery has one. Hand and Paw, of course, covers Birmingham, Tuscaloosa. I'm sure Mobile has one, although I've never looked it up. And if you are in an area where there's not a designated agency that provides animal assisted therapy, you can always go onto the Pet Partners website. Sometimes more smaller communities or more rural areas might have individuals that aren't part of an agency but are members of Pet Partners and provide animal assisted therapy services in their communities. So that's always a good resource too. I think that's about it for my presentation. I think I just have some more pictures.
That's excellent. You've gotten so many good presentations. We're against our hour.
I'm sorry.
No, you've done a great job. I thank you for coming back and doing this with us again. And great information. Thanks, Holly. Thank you. Great information. Thank you. Great presentation. Just a lot of positive feedback, and we appreciate you and the work that you do and in bringing that to us today. Y'all please join us again on the 19th when we'll present occupational burnout. And thank you again, Holly, so much for all that you do, including today.
No problem. Thank you for participating, and please feel free to reach out if you have any questions.
Great. Thank you so much. Y'all have a great week.
You too.